All right, we're on your side today taking a closer look at a study about women who have a high risk of breast cancer and radiation from mammograms. The scans might actually increase their chances of developing cancer. Here to talk about that study is our local medical expert, Dr. Dave. Good afternoon, doctor.
Good afternoon. Good afternoon, Mike and Jenny. My patients have been asking me about the study which says that women whose genes put them at a high risk for breast cancer that have been exposed to diagnostic radiation before the age of 30 might have an increased risk for breast cancer. The women in the study had a known mutation for the BRCA1 and BRCA2 genes that puts them at a high lifetime risk for breast cancer, and the diagnostic radiation that they were exposed to includes CT scans, chest x-rays, bone scans, and mammograms.
Yeah, people are starting to worry about all that radiation just from the preliminary tests.
We know that mammograms are important for detecting breast cancer at an early stage. So what does this mean for women who are undergoing mammogram for screening and follow-up? So the first thing that women need to know about the study is who is not included in the study. The majority of women who are undergoing screening for breast cancer beginning at the age of 40 with yearly mammograms and have an average risk of breast cancer were not included, and they should continue following these screening recommendations. And for women who have a known history of breast cancer without the mutation that are undergoing mammograms as recommended by their oncologist, they were also not included. They should also continue following their oncologist recommendations. It only included a small percentage of women with a mutation, BRCA1 and BRCA2 gene mutations. The second is, why is the study questionable? The study does not prove a direct link or cause and effect between exposure to low doses of radiation and breast cancer. This would require a special study called a randomized clinical trial. And then number three is, why is the study plausible or even being considered? The BRCA gene is involved with DNA repair. If a person has a gene mutation, he or she may not be able to repair DNA after exposure to radiation. So theoretically, even a low dose of radiation at a young age can lead to cancer formation later on. So finally, number four is, what should women do? If a woman has a high risk of breast cancer because of the mutation, she's recommended to start undergoing breast screening with mammograms and MRIs in her 20s. A mammogram is specific for breast cancer but exposes women to low doses of radiation. An MRI is sensitive, does not expose a woman to radiation, but can lead to unnecessary breast biopsies. So if you are a woman with a high risk of breast cancer and you're younger than age 30, you want to talk to your doctor about the risks and benefits of having both an MRI and a mammogram, or an MRI alone. And for the rest of us, men and women, if you're having diagnostic tests, whether it's a CT scan, a bone scan, or any type of diagnostic radiation, make sure your doctor explains to you what the risks and benefits of that test are for you.
Bottom line, just talk to your doctor.
Exactly.
Have a good relationship with your doctor. All right, Dr. Dave, thank you. Dr. Dave joins us every Tuesday right here on The Noon Show. If you have a topic or a question or a topic idea for her, email it to us at newsdesk@cbs47.tv.